So compliance literally means the amount of pressure that's needed to change a volume. So I always give the example of blowing up a balloon. Right at the beginning, when you start blowing up a balloon, it's really low compliance. The balloon is really, really like thick and stiff. So you have to use a lot of pressure to get a little bit of volume. And then afterwards, as the balloon starts enlarging, the compliance is a lot lower. So you need less pressure to produce that volume. And the lungs are kind of similar like a balloon. Right at the bottom, when they're completely collapsed, they're really stiff, so their compliance is low. There's a golden period in that lungs where they have good compliance. And then when they're really hyperexpanded, obviously to get them to open up even more, then the compliance goes down again. So that's kind of compliance within the same lung. What we're talking about here is how the compliance of the whole lung changes. So first of all, when babies are born, they've got fluid, they can be really immature. If they're lacking surfactant, then the lungs are really stiff. By definition, we are giving surfactant to make the lungs less stiff, so to improve the compliance. So the point that Dr. Stritter is making is that if you are on a pressure guarantee mode and you give the surfactant, then suddenly the compliance is going to improve by so much. So if at the beginning, right before, say we were on pressures of like 23/6 on your ventilator, and we haven't given surfactant yet. So initially with 23/6, that was delivering a tidal volume of 4 mLs per kilo. After you give the surfactant, the compliance improves by a lot. Maybe suddenly your volumes are going up to 10 or 11 mLs per kilo because the compliance has improved so much. So delivering the same pressure will open up the volume so much more. So the point that we're making here is, if as you're giving the surfactant or periods where you expect the compliance to change, if instead of delivering a set pressure, you're delivering a set volume, then the machine will just give a lower and lower pressure. So obviously, if you're sitting by the machine all the time and actually decreasing the pressure as you're seeing the volume go up, then yes, that would be better for the lungs. But the argument that you could make is that we're very rarely all sitting by that. So we can't set up a system for the hospital where like the provider is just sitting by the machine typing stuff in all the time.